Hi friends. Welcome to Dentistry Love. Today, we are gonna see about Endocrown. Let's see. What is Endocrown? Indications and contraindications. How to make crown preparation for Endocrown. What are its features? Advantages and disadvantages. What is Endocrown? Endocrown is a non-lay restoration on endodontically treated teeth, which is more conservative than traditional post and core system, and uses the adhesive resin with monoblock technique. Indications. It is recommended for RC-treated teeth when there's substantial loss of tooth structure, restricted interocclusal space or a short clinical crown. Molars with short calcified canals. Contraindications. For persons having parafunctional habits. Depth of pulp chamber less than 3 mm, cervical margins less than 2 mm, if adhesion can't be assured. Endocrown preparation method. Occlusal preparation. The goal in preparation is to achieve an overall reduction in the height of the occlusal surface, at least 2 mm in axial direction. The reduction can be achieved by drilling 2 mm deep grooves, then using a green diamond wheel burr to reduce the occlusal surface. Preparation of the cervical margin or cervical sidewalk using a wheel burr parallel to the occlusal plane. Axial preparation involves eliminating undercuts in the axial cavity. A cylindrical, conical green diamond burr with a total occlusal convergence of 7 degrees is used to make the coronal pulp chamber continuous with the access cavity. Polishing the cervical band. The burr used in this step has the same taper as the one used in axial preparation, but a larger diameter and a fine particle size. It should be guided around the entire surface of the cervical band, to remove irregularities and produce a flat, polished surface. The margin line should appear as a regular line with sharp edge. Circumferential 1 to 2 mm depth butt margins and a central retention cavity inside the pulp chamber. Constructs both the crown and core as a single unit, monoblock structure and doesn't take support from root canals. Thickness of ceramic occlusal portion of endocrowns is usually 3 to 7 mm. Preparation for premolars, 3 mm diameter and 5 mm depth. For molars, 5 mm diameter and 5 mm depth. Preparation of the cavity floor. The entrance of the pulp canal is opened. Gutta percha is removed to a depth not exceeding 2 mm to take advantage of the saddle-like anatomy of the cavity floor. This should be done with a non-abrasive instrument to maintain the integrity of the canal's entrance. No drilling of dentin is carried out. Cleaning of pulp chamber. Ultrasound is recommended to clean the pulp chamber and its floor thoroughly. Abrasion is not indicated. Advantages: less complex, more easier to perform. Allows minimal tooth wear, thus strengthens the tooth. Preparation design is conservative and biological width is minimal. Allows re-entry to canals if required without post-removal. Reduced patient cost and chair side time. Disadvantages: risk of debonding and root fracture in endocrown. Limitations may be restricted to the ceramic material, which must be acid etchable. Ceramics can't be used in anteriors. Thank you for listening. Please do subscribe, friends.